Good morning, one and all present here, to all the respected dignitaries. So myself, Dr. Shweta Ravichandran, I will be presenting on outcome of scleritis from a single center, a retrospective analysis, no financial interest. So introduction, scleritis refers to the inflammation of the sclera. It can be anterior, intermediate or posterior depending on the anatomical involvement. Systemic association is reported in about 50 to 80% of the patients according to the various studies. Anti-inflammatory therapy is timely essential as to prevent the visual loss arising out of the secondary corneal or retinal complications. Recurrent necrotizing and posterior scleritis warrant the oral immunosuppression to prevent the catastrophic sequelae. So my aim and objective of the study was to study the clinico-demographic profile, etiology and the treatment measures and the outcome and follow-up of the patients with scleritis, and to compare the improvement in the visual acuity and the intraocular pressure measurements at baseline and post-therapy. So materials and methods, it was a retrospective study that was conducted in our center from January 2022 to August 2022. Through slit lamp examination was used. Data was retrieved from the electronic medical records as well as through telephonic interrogation with the concerned patient. Anatomical involvement, pattern of inflammation, therapy details, visual acuity and IOP and baseline was monitored. The continuous variables were presented using the mean standard deviation, median range and categorical variables in frequency percentage, and we used Wilcoxon sign rank test, and P less than 0.05 was considered to be significant. So the results were like total number of patients were 40 and the total number of eyes was 52, median age was 43 and female preponderance was 25, and bilaterality was seen in 12 patients, and the median duration of follow-up in months was 3 months, and the time to diagnose from the symptom onset in days was 11, and the total number of follow-up visits in the entire cohort was 3, and recurrent cases were 8. So the most common presenting symptom were pain, followed by the blurred vision, redness, swelling, and photophobia. So the most common etiology involved in this was basically the tubercular, which accounted for 25%, and the other were idiopathic causes were 17%, and the other autoimmune diseases such as the rheumatoid arthritis, SLE contributed, and few patients were in the pregnancy and postpartum, and trauma and post-surgery also contributed to 7% and 5% respectively. So mostly it was an anterior scleritis, 70%, and posterior was 30%. And among the anterior scleritis, 50% was diffuse, followed by the nodular and necrotizing. So most of the patients, we treated them with systemic steroids with topical, and also with few with NSAIDs. An injection PST posterior subtenons was given for a patient with vitritis and methotrexate. So the anterior segment complications were like limbitis, peripheral ulcerative keratitis were more common, and glaucoma and cataract also occurred in few patients. So this was a semilunar sign that was seen in patients who were in the dormant phase of the scleritis. Basically, they had a posterior corneal opacification which had a semilunar pattern. So this was actually published in IJO by Divya Ashok et al. So we can see that in the anterior segment OCT, there was an hyperreflectivity in the corneal endothelium, and there was a perfectly normal anterior part of the cornea, and there was no vascularization. So the posterior segment complications were cystoid macular edema, and few had optic disc edema and exudative retinal detachment. So there was not much difference in the uncorrected visual acuity. There was no significant difference pre-treatment and the post-treatment, but the best corrected visual acuity improved, and there was no much change in the intraocular pressure. So moving on to the discussion, female preponderance was there. Bilateral presentation were more common compared to other studies. Post-tubercular etiology was higher when compared to other literatures. Anterior segment complications were common. Steroids and NSAIDs accounted for resolution in most cases and required cytotoxic agents only in few. The limitations of my study was it was a retrospective study design, and it was a limited sample size, and it was a short follow-up, and biologicals weren't included much. So concluding, scleritis is potential for side effects which required both close monitoring and cooperation among the physicians caring for these patients, including the ophthalmologist, internist, and rheumatologist. Most commonly seen forms are the anterior diffuse nodular scleritis, which are associated with systemic disease in about 40% of the patients. The less frequently seen necrotizing forms are associated with higher incidence of systemic disease in about 70 to 90%. So these are my references. Thank you, sir.